Welcome to Cut to the Crypto, brought to you by Unstoppable Domains. I'm Tony Karen Brown, and I'm your host. This is your 15 minutes of crypto, asked and answered. Hi, today I am joined by Dr. Mala Mawkin. Mala, thank you so much for joining me today.
I'm so excited to be here. Thank you for having me.
It's what people don't know is we've just had like a 30-minute in-depth conversation before recording, which is very fun. You must honestly have one of the most impressive CVs I have come across in a long time. And so I'm going to try and condense it and get all of the most important pieces right. But you are currently the head of market development at Lever Clinic, which I believe recently launched the UK's first online pain clinic. Is that correct?
Exactly that, yeah.
And you were a big part of that project, weren't you?
Yeah, so I joined the team really early on and just absolutely love working there and love working with such incredible people that are passionate about actually fixing some social and healthcare inequality. So yeah, it's been brilliant.
No small feat, that's for sure. And if that wasn't enough, you are also the host of the Royal Society of Medicine's Digital Health podcast. You're a TEDx speaker. And massive congratulations on this one. You were recently named one of the UK's most influential people in digital and tech. Congrats on that.
Thank you.
It's pretty impressive. And if you thought that was impressive, there's more. The list goes on. This is my job. I have to make you look good, and this wasn't difficult. You've also been featured on Forbes 30 Under 30, Vogue's list of the 10 rising female stars, and you are the UK Women of the Future Awards finalist. You're one of the finalists on that. So, congrats! As I said, you've got an impressive CV.
Thank you so much. I mean, it's an honor to speak with you. So I feel like I feel the imposter here in the room, and now I feel very comfortable after that. So thank you very much. That's really kind of you.
No, I'm just repeating everything that you've achieved and you've done out in the world, which is really impressive. And here's what I wanted to chat about today, because there's something really interesting for me in technology, which is anytime there's a new technology that comes along, there's a lot of buzz and there's a lot of excitement. And dare I even say there's a little bit of hype about all the ways that this tech is going to change our world. And we often talk in tech that what starts out looking like a bit of fun or a bit of entertainment actually can truly end up, if we allow it to, really changing a fundamental aspect of our society and have a consequence or deep consequences on a day-to-day life. And so today I wanted to go a little bit beyond the hype and talk about one area where crypto, but also Web3 could potentially have a profound impact. And that sector is healthcare. And I think that you and I are very much in alignment on this, that healthcare shouldn't be this utopian thing or this utopian system that only works for the few versus the many. And I think we're not quite there yet. And as someone who's spent a decade working at the intersection of politics and tech, I know what it feels like to look at a very archaic, dare I say, industry and look at the tech industry and think, oh, there's a lot of ways in which technology can be applied here and really change the way we've done things for a long time and hopefully for the better. And so the more I researched crypto and healthcare, the more it became somewhat apparent, and I hadn't thought of it before, but somewhat apparent, all the ways in which Web3 could potentially change the space if we get the infrastructure right and if we get the foundations right and hopefully change it for the better. So what I want to chat with you today is obviously healthcare and crypto and Web3. But you said something that I've thought that has stuck with me for the last week or so, which is you said that you weren't interested in fixing the healthcare system, but rather rebuilding it. What do you mean by that, Marla? And what is the role of crypto and Web3? What role would crypto and Web3 play in this rebuilding of such a system?
Oh, it's so big, isn't it? Yeah, it's, and I suppose that we've really got to start by kind of working a bit backwards here. Is kind of what's the status play right now of health, right? It's patchy. We're kind of everywhere with it and nowhere really. Okay, so as a human being, your experience of social media is pretty the same everywhere in the world. You know, your experience of consuming podcasts pretty much the same, right?
Yeah.
Everywhere in the world. You stick your headphones on, you listen, and you do it. But somehow we've got to a point where the service of healthcare is so fundamentally different wherever you are in the world. And there's not been kind of that one driver that has pushed everything into the same direction. That's kind of caught everyone up. That's really done it. Now, what we thought would happen was with internet, we'd start getting some online consultations. People would use apps to track everything. Now, like, I am a healthcare professional who loves digital health, and I'm not even wearing my Fitbit today, nor any wearables, nor do I stay attuned to anything. I don't know if you use any apps or anything on your phone for your health.
I don't. My husband more than I do. I started doing online consultations since moving to America, but I'm also very nervous when it comes to personal records and healthcare data and putting that online for some reason.
Well, it's no blame, right? Because we don't know where it's going or where it's being stored or who has it, and there's
how it's being used.
Right. Yeah. And there's kind of two things that happen. So I wrote an article where I said, right, health one, if we look at it, was kind of that we go to the hospital, you kind of come back and then you do your bits of homework and then you hope you get better and you take your pills or whatever. Then you got your health kind of 2.0, which is your pre-post pandemic kind of era where you're starting to go online, wearing your wearables, doing a bit more, but also starting to find other people that have the same problems as you. And so you're connecting a lot more on Facebook groups, Reddit groups, etc., with anyone that has the same medicine as you, and you're kind of getting tips about how they use them, or maybe you found someone else that has IBS or someone else that has breast cancer, and everyone gets talking. What do you do? How do you do it? And it's that sharing of information that's become kind of that. But fundamentally, the basics, what they were trying to achieve here was that people need to take a bit more ownership. That's what we keep hearing. People need to take a bit more ownership over their health, right? And so we were kind of starting to get there, people kind of doing a bit more self-management, using Headspace or apps or kind of going onto these groups. But we weren't there yet with people taking ownership. And fundamentally, it's because no one really knew what they were taking ownership of. So now you've got this hot potato of healthcare kind of flying around, right? Where you've got an old archaic system of healthcare, which is really, really difficult to change because, it's the old archaic system of healthcare. It's like we were saying before, politics or anything else. It's kind of very archaic kind of systems that are in place.
It's got that legacy. It's really hard to change legacy than to start from blank canvas.
Exactly. And you've got this hot potato of who's taking responsibility. Is it the patient's responsibility to go get the COVID vaccine? Or is it is it the society's expectation that everyone should get it? Is it the patient's expectation that they should be the ones that sign up to go get breast screening? Or are we mandating that everyone goes and does it? And where does that line get drawn between us telling the patients, public health, stop smoking, start losing weight, start doing this, and then the system stepping in and doing it. Now, because we've not had that, no one taking responsibility, we've now got to a point where the healthcare system is really broken. And so Web3 fundamentally offers the opportunity for each of us to take that ownership of our own healthcare and fix it ourselves instead of waiting for the system to fix us.
And there's an interesting piece there. As someone who born in mainland Europe, France, lived in mainland Europe for almost 20 years, then moved to the UK and now has moved to America. And my healthcare experience has been fundamentally different. And I had never thought about it in this way, Mara, but exactly what you've just described is what has changed is my responsibility. And I feel way more responsible in America than I did in Belgium, for example, where the school mandated was just like, hey, it's school trip, go and see the doctors. This is happening twice a year. And then my doctor would call me up and saying, you're due for a checkup. None of this is happening here for me in America, it's a very bizarre shift that has experienced. And I'd never put it through that lens and that angle, which is interesting.
It's so wild when you see the discrepancies, right? But now we're at this point where you've got this technology is finally here to achieve the values, the core values of what we all wanted out of the internet helping healthcare, right?
Yeah.
Being able to own your own healthcare records and take responsibility, check, right? We can do that with blockchain, crypto technology, and Web3. We can actually start to be able to do that. You've got...
Is that technology, Marla, already readily available today? Or is that slowly starting to be possible? Or what does that look like? What is the state of the infrastructure, the tech today in like, for that very real good example of ownership of your records?
It's so clunky. It's so clunky beyond belief because you're built, I always like to say, it's kind of like you've got this cake that's really sloppy at the bottom, like a really sloppy cake base, right? And we're just adding on like little like cake bases that are kind of just like all kind of falling apart at the same time, and the icing is going everywhere and everything's a bit of a mess. Actually, no one ever wanted the cake. We didn't want it. We wanted something a bit healthier, and that's what we need to move towards. And that is kind of what we're seeing here with right now. Like the cake analogy is really the paper healthcare system records that you've got, where you go in, you've got those files, and they're like filed away in one of those wheelie things that you have to put on iPhone and shut. And now we're finally getting the essence of us being able to own our digital identity, right? And this is where we're talking on unstoppable domains as well here, is that this is really it, because the technology is starting to appear now where we can own our own identity on the internet, which means that we can own our own data records, which means we can then get to share what we want to share with research, with different communities, be a part of a breast cancer community, but actually be able to contribute and be able to really own a stake in that community, and then be able to share your data records if you do want to contribute to some type of breast cancer research or project or anything like that. I mean, that fundamentally is happening. It's that turning on and off and being able to link into the healthcare system, which is going to be the difficult bit. And also there's loads of other questions, like what do you do when someone perhaps doesn't have the doesn't have the capability to be able to say at that point in time that they want their data shared or not. Maybe they have a lack of mental capacity, etc., etc. So I think there's loads of questions to answer, but the technology fundamentally, we're getting there.
It's interesting because I honestly, before talking with you, I had never thought, I'd heard the idea and the concept of your digital and online identity. And I feel like healthcare is just like the perfect example of something that you would need at any given moment. Like, what's your blood type? You haven't. I remember getting into a snowboarding accident in the Alps somewhere in Switzerland. And because I was part of the EU, I benefited from, there's a German helicopter flying in, picking me up, then putting me on a German ambulance, the ambulance bringing me to France, swapping from German ambulance to French ambulance taking me all the way to Belgium. And that interoperable system that happened was only due to the fact that I was sitting all within the EU. But that the same didn't happen with my records. It was much harder for my healthcare records to go, no, we saw her in a hospital in the Alps in Switzerland. These are the x-rays, this was taken. And so that was interesting that the transportation was kind of interoperable and seamless, but the healthcare records had a harder time. And then how do you translate it in what language? So there's something really interesting there. And what I'm hearing from you, Marla, is really this idea of going from a siloed environment of how healthcare records live to this sort of cross-platform potential, or I'm using cross-platform for lack of a better word, to then this patient-owned world in which we can live, where it actually sits with you.
Exactly. That decentralizing of healthcare needs to happen, because why is it that if you are a patient in Australia, the best specialist for you is in the USA, and you are being told that your healthcare records can't be shared over there? You're a patient in the NHS in the UK, and fundamentally you need to see a doctor in Thailand, but how on earth how do you share it? And it's so difficult to have ownership over a scan of your own body. That's just crazy for me. So, and I think that, what we're talking here is obviously, big picture, like how could this look? And we were joking before that we might listen to this back in a year's time and be proved completely wrong. But the essence of it is that we have got these big problems where everything else is really speeding ahead. But if we let healthcare lag behind being able to be cross-country, cross-sharing, as you were just saying there, being able to pick up and drop it and being able to share that, we're going to have the biggest healthcare inequalities we're going to be seeing, and that's going to be coming forward on a mass scale. And it's not just, problems for the developing. This is going to start coming everywhere, because there's only so much that we can be doing individually as countries within our healthcare systems, we need to start working together now to really solve these healthcare challenges.
Is that one of the things that excites you the most, this idea of the potential of being more accessible to all people and the potential of it being more user-friendly? And obviously, as you said, right now, the technology isn't quite there yet. But is there anything else that I'm missing from this, of just like the potentials are it can be accessible to all and to more people, lowering that barrier to entry and then that ownership? Or is there anything else that you would add to that?
Oh, I think you're spot on. I think it's that, the question that you asked at the start, how do we change the system instead of just trying to fix it, is that fundamentally, once you've got the ownership of it, you have changed the system so that we're the ones that are geared up to be able to actually to use it properly. And that's what we need, right? From a global healthcare system, we need to be able to have that ownership, to be able to take our records from place to place and actually be able to share it. I mean, my mission personally as a human being is to be able to help solve social and healthcare inequalities using technology. And that fundamentally is what I try and do in all the work I do. And this technology is going to be able to be the opening of the door for this to start moving forward. The values that we all joined healthcare for, that we all join these things for, is going to be opened up by technology that allows for that level of interoperability. And I'm so buzzed about it. I can't wait. So
and I'll leave people with this, that I think you've hit the nail on the head, is it's only once you feel like you've got ownership of something that you can actually be successful in that space. So how can we be successful about our own healthcare if we don't feel that we have ownership of it? And the way you explained it there, I think it's just so spot on, and I'm starting to see those potentials. Marla, thank you so much for helping me answer this. This is probably one of the meatier and harder questions that I've put to someone, so I appreciate you taking the time and doing it in such a succinct way.
Thank you so much.
And that's a wrap on today's episode. Thank you for sticking around to the end, and I hope you enjoyed today's guests as much as I did. If you've got big crypto questions, send them our way and we'll attempt to get them answered for you. And for the more seasoned crypto investors and enthusiasts, do go check out our weekly podcast, The Unstoppable Podcast, to learn more about the latest innovations in Web3, NFTs, and the decentralized web.